Okay, 6. My friend Eric recently had a baseball injury a little bit ago, and at that time we diagnosed him with a grade 2 hamstring strain, and still to this day he's having some pain. What would you describe your pain level as?
I'd say an 8 out of 10.
Okay, and he says he can't fit his knee all the way, and he's still having that pain. Some of the treatment goals is get that pain from an 8 out of 10 to about a 2 out of 10 by the end of this week, and have it completely gone by next week, as well as reduce some of the edema he has. He has slight edema, and to be able to get that full knee flexion. The modality we're going to use today is we're going to use estim, more specifically high volt, and as you can see in the video, I have 2 pad placements. So far, there's contraindications, as I just stated the indications. Contraindications related to this area would be have you had any malignous tumors or cancer in the past, recently?
No.
Okay. From my point of view, infections, which you can see there are none, nor open wounds. And in general, do not go near a pacemaker or anything in the thoracic region as well as the brain. But since it's strictly hamstring, we don't have to worry about that. Some other precautions as well as don't do wrong pad placement. Do not crank up the voltage too much. It can cause up shock them. As well as don't make sure you have the correct duty cycle as not to fatigue the muscle. You want positive effects and not negative effects. Parameters I'm going to use, like I said, is high volt, and I have the pad placement, as well as 250 volts, as well as 1 to 120 volts per second, and we're used for 15 minutes. And basically, you turn it until you feels it. You don't want to go too much. So, like I said, I have it placed. Tell me when you start to feel this there. And like I said, that runs for about 15 minutes. Some treatment success would be, like as I mentioned, reduce that edema to non-substantial, get his pain down a lot by the end of the first week, and get it completely gone by the next, as well as get that full range of motion. And another thing, a treatment success, that would be to get him back to playing with baseball and doing what he loves. My rationale for using this is the indications and the effectiveness that it's happened. Not only has it's been used before on patients like him, it's worked, as well as I know it's going to work, and that's why I chose it.